Hello, I'm Dr. Rajkumar and welcome to this program. Today I'm going to be speaking a little bit to you about what bariatric surgery is all about. So bariatric surgery is the art of getting an overweight or an obese patient back down to his ideal body weight, or at least as close as possible to his ideal body weight. Over the last 40 years, the procedures of laparoscopic bariatric surgery have become reasonably standardized. We do them all through the laparoscope, which means, as you all know, make tiny little keyholes. The key word there is keyholes, and through those keyholes we put specialized instruments inside the belly or the chest or sometimes even the neck and perform operations. What are the available types of bariatric surgery? Right now, these things have been fairly standardized and all over the world. The Roux-en-Y gastric bypass, the laparoscopic gastric sleeve, the laparoscopic mini gastric bypass, and the laparoscopic biliopancreatic diversion. But almost all over the world, the operations have been standardized to one of these four procedures. It's a surgery that can correct your metabolism. It's a surgery that can bring down your cholesterol, your diabetes, your blood pressure, prevent you from having knee operations, prevent you from having heart operations. I always joke and say, when you do a bypass, you bypass a bypass. That is, you can bypass the coronary bypass by having a gastric bypass. And not only will you be saving yourself multiple operations and a lot of money, you will be healthy, much more handsome and much better looking and much better equipped to run through life. This perspective comes from me because we are one of a handful, a cluster of centers across the country where we do virtually the entire spectrum of bariatric surgery, starting from a band or a sleeve or a gastric plication, all the way up to complex procedures like ileal transposition and biliopancreatic diversion or duodenal switch, and of late revisional bariatric surgery. Now that brings me to the last part of my talk. In India, revisional bariatric surgery is on the rise. If you look at the last 12, 13, 14 years, a number of patients have had bariatric surgeries, some appropriate and some perhaps not so appropriate. I'm not commenting on that, but for whatever reason, when there is weight regain or some complication of the bariatric surgery, then the experienced surgeon comes in to perform what is called revisional bariatric surgery, in which you have to actually revise what was done and pull the chestnut right out of the fire, pull the patient out of a crisis. However, bariatric surgery, my dear friends, has come to stay today in India and is here for the long haul. To learn more about such things, please do subscribe to our channel and participate with us and enjoy the art, the science, the skill and the craft of medicine. Thank you very much.